Hello, everyone. I wanted to welcome you to our week 8 of 7001, our DNP-FNP Transitions to Practice class. And as you know, I teach both 7060 and 7001. So some of you are also in my 7060 course and know that I had come up with some ideas for you to participate in some crisis management by giving you options for some of the remaining assignments. So the first thing that I wanted to remind you of is that I'm just about done grading your personal philosophy submissions. I should have those done later this evening before I go to bed. And then the second thing that I wanted to remind you of is that I have provided you some free point choice options. So there's 3 categories. You are eligible to choose one choice in each of those 3 categories. So the first choice is related to the Nance 2008 book that we are reading in 7001, which is a sister book club book to the one that is in 7060, which is Charting the Course, and the one that we're reading in 7001 is Why Hospitals Should Fly. So I think there's been a little confusion for some of you related to the fact that there are 2 separate Nance book club books. There has been information disseminated prior to the start of the semester as well as during the semester that there indeed are 2 books. And we have set the courses up such that the postings for each of those 2 Nance Book Club readings are not due the same week, which hopefully has helped to maybe eliminate some confusion about that. The other thing is we have tried really hard to have the students understand the value of each of those book club readings related to either leadership or just general transition from the registered nurse to the DNP leader or the DNP FNP leader and practitioner. So let me know if there's any confusion still. I think we've got that all resolved. The other thing is, as I've mentioned before, initially 7000 and 7001 were taught semester 1 of the DNP program, and the DNP leadership course was taught the second semester of your program of study. In review, it was anticipated and contemplated that having the leadership course in the first semester with policy and your introductory DNP courses would be a better process for success related to the program of study for whichever track you are in. That, of course, meant that we now have 2 Nance textbooks or book club books in the same semester. Let me know your thoughts on that. I feel like both books are valuable, but if the confusion is such that you would prefer something different, don't hesitate to let myself or Dr. Trump know for 7060 of your concerns, or myself or Dr. Trump know for 7060 and or 7001 your concerns related to that as well. So first of all, as mentioned, you have the Nance Book Club discussion where you can choose to get free points for no initial posting and no reply. And then for the remaining stay connected, say anything, you also have the same option, no initial reply, no replies, and free points for that. The other thing that has happened based on some feedback and also wanting to lighten the load, I've taken the liberty to update the final 2 assignments into one. Those assignments are due as a combination on Monday, 11/30/2020. And what will happen is on that particular assignment, it is now called the DNP Role Model Interview and Achieving Essentials and Competencies. So for this, you will continue to do the DNP role model interview that we have discussed. We have already decided that October 28th at 7 p.m. we'll have the first panel interview. And then we have options for either Thursday, November 5th, or Tuesday, November 10th, which would be in the late afternoon for that date. We potentially could do 3 interview times if we need to do that, but we were trying to do 2. And in each of the interview, we would have 3 or 4 panelists, likely 3. Those sessions will be available in your course, the 7,000 course via Zoom. You'll be sent an invitation to participate in one or both of them. And each of those interview sessions will be recorded. And if you're not able to attend at this point in time, you still may listen to the interview and use that interview as part 1 of the final assignment. For part 2 of that assignment, you will be aligning the competencies with the DNP essentials, so you don't necessarily have to compare and contrast. Just know that with the exception of ethics, all of those different DNP essentials and FNP competencies align well. And what we'll ask you to do for the second part of the reflection is to look at each of the different the FNP competencies, and just write a little bit about how you think you can apply in future practice that competency for yourself. And some of those competencies may be discussed in the interview by your the panel that you participate in or listen to. And this is a reflection. It should be APA format in that I need you to use in-text citations and personal communication. I've given you some tips in the assignment, so I'm not going to repeat that in detail, but just look at it. And basically what I would expect is 1 or 2 paragraphs in each of the 9 competencies. And for the interview, you will probably have maybe 1, well, you'll definitely have 1 because you want an introductory paragraph, but you'll have 2, 3, and 4 paragraphs based on the information shared from each of the interview panelists. Those can be listed in a bullet format, and I've given you some examples of how to do that. So let me know if there's any questions on that. We have removed a significant amount of the final assignment and just brought those FNP competencies into this assignment. The other remaining assignment is your DNP FNP transition assignment on ways of knowing and primary care. This is a follow-up to your personal philosophy assignment, but is slightly different. And what I'd like you to do is to look at this from a slightly different perspective. So you're going to look at a couple, you're going to compare and contrast 2 nursing models, philosophies, or theories. And there is some information in the units and also the readings in that Zaccanini book that talk about some models or theories out there. You can actually use your own philosophy as one of those 2 if you'd like. And then from there on, you're going to apprise the purpose or value of a personal philosophy to future DNP practice. Now, you've done this a little bit in the personal philosophy paper, but what I'd like you to do is to look at it from an outpatient clinical setting and look at some of those values and practice skills that you will acquire during the program and approach it from that perspective. The third part of that is, how do FNP essentials influence your nursing philosophy? And I know that some of you talk generally about that. Some of you actually picked some DNP essentials to talk about. But this is the FNP part of our course, and so I need you to look at that from the FNP practice, skill, primary care, provision of care perspective, and from those actual FNP competencies. And then finally, you're going to articulate 2 of your personal priority considerations related to DNP practice with an FNP certification. And again, rather than looking at the DNP essentials for this, I'd like you to pick the associated FNP competency and talk a little bit about some of those related to your personal philosophy, core beliefs, and some of the things that you talked about related to advocacy, lifelong learning, and knowledge dissemination. So let me know if you have any questions about that. Both of these still need to be in an APA format. You don't need a cover page nor a separate reference page. reference page, sorry, but I would like you to go ahead and do a double space just because it's easier to read, and if I want to make comments, I can do that more easily. And then, as needed, use in-text citations to support whatever it is you're talking about. So I think the simplification of this assignment, the ways of knowing in primary care, and the final role model interview and FNP competency achievement should make the 2 final writing assignments easier. Again, I don't care that you write it in full paragraph format. You're certainly welcome to use a bulleted format if that's easier for you, using partial phrases rather than full sentences. But make sure you communicate what needs to be communicated and make the writing as concise and simple as you possibly can. So let me know if you need anything. I appreciate each of you and want you to understand that some of the changes in this course have been related to using your voice and being an advocate. I've chosen to be advocates for you and use my voice to help simplify some of the assignments in this course. If you still have ideas about how that might be accomplished in a different way, we certainly can continue to have that conversation. We've made several changes in this course as well as 7060 to benefit you. I don't want to confuse you, but I hope that the changes have been beneficial for you and are helping you as you navigate this first semester of a 7-semester program, where you will have a lot of writing for sure, but you'll also have a lot of fun learning about FNP practice, some of the skills associated with that, a lot of detail about pharmacology and pathophysiology and diagnostic reasoning, as well as lifespan, particular diagnoses and attention to particular aspects of the lifespan that FNP providers need to do. Remember, this is family practice, and you teach, you teach patients of all ages, but you also treat patients of all ages, and so you need to be cognizant of common diagnoses and best practices, and hopefully you'll have a lot of fun in this program. I've enjoyed helping create it and have enjoyed teaching over the years a number of students. And just so you don't worry too much, all of our students, except for one, have passed their exam for 3 cohorts on the first trial. That second one passed it on the second one. So you all are going to be certified and be working as you choose in the near future as an FNP practitioner. Thanks. I think you're all great, and let me know if you need anything.